karma means, or pre-operative means, whatever I told, everything I have told just based on the patient. What we have to do for patient. Always keep in mind that pre-operative means not only applicable for patient, even for doctor, for instruments, for OT. You see, just one example. One patient came, you make them ready, but you as being surgeon, you are not being ready, you are not become sterilized yourself. Okay, even your instruments are also very nasty, it's also never ever cleaned properly. Even your OT, that is also full of garbages, okay, and all. Even their rats are running the like that condition. This is also not preferable. So that also may deal to send you the jail. Okay, that's why only by preparing the patient, not your duty, but also you have to prepare yourself as doctor. So what are those that I am going to say? Before that, first I am telling, in case of Purva Karma, what Acharya Shusra told. He told, usually we are doing, before doing operation, what we are doing, we are keeping all the instruments ready. I need artery forceps, I need tooth dissecting forceps, I need cottons, I need blah blah blah, whatever is required, the gauze, the this spirit, the betadine ointment, povidone iodine solution, hydrogen peroxide, everything we are keeping ready over the instruments trolley. Same like Acharya Shusruta also told, before performing, first you have to collect all the materials and you have to keep aside. That is called the Agropaharana. Okay, what are those that has been told here? अत अन्नतमं कर्म चिकीर्षिता वैद्येन पूर्वम एव कल्प इतम पैनि भवन्ति तद्यथा. What we have to give? See, our materials is little bit different than modern science. Yantra, Shastra, Shara, Yagni. How to correlate? Yantra means all the instruments, all the blunt instruments. Shastra means all the sharp instruments. Shara, we are knowing the Shara, that is the Shara alkaline materials which we are usually making. Okay. Next one is the Agni. Here Agni means Agni Karma related all the instruments. Modern science, what they are keeping, all the instruments like us. Usually they are not at all using that much alkaline preparations. Okay, sometimes they are entirely, okay, this is a copper sulfate, sometimes they are using. Why? Sometimes for scrapping purpose over the dushta brana, or the brana or the ulcer which is not getting healed up. So that practice also we have done in South India. There we are using some copper sulfate, just scrapping over there. So this kind of materials we are keeping. And in Ayurveda, Agni, there is a Agni Karma related all, Shalaka. Sometimes this Pipali, Aja, Shakrit, Danto, Godanto, Sharashalaka, whatever. Even Shodra, Gura, Sneha, everything we can keep. And in modern science, they are using the electric cautery machines. Okay. Then here also told Shalaka, Sringo. Okay. Now nowadays the very nice machine already developed, that is Sringavacharan. Okay, very nice instrument already established. That I'll show whenever I'll take the class for Rakta Mokshana. Okay, and this procedure is also very nice. Next one, Jalauka. That's also we have to keep inside the glass container along with the water, and there would be some small holes. Then the Jalaukas can inhale and exhale their oxygenated water and all. So it is very important for them. That also we have to keep inside our OT room. So our some specifications is there. That is not exactly same like modern science. Next one is the Alabu. That also we keep there. And the Pichu, Prota, Shutro, those all just like in our modern science. They are cotton, gauze. Okay, sometimes we are keeping padded gauze. Okay, even there that time this pads also not that much that much was not recognized. So they are sometimes for covering the places they are using patra. Patra means usually leaves. So previously also, I don't know, I forgot or not, during these burn cases I told that guruchi patra, by that also we are covering the areas. Okay, so along with that patta also same, like just this is also made up by cloths and all. Okay, and next, that can be correlated with our any gauze piece and all. Okay, next, madhu, khrito, pasha, poyo, toilo means for just instead of any kind of ointment, whatever we are using, what we are using, most of the cases we are using the povidone iodine ointment. And sometimes for avoiding any secondary infection, sometimes we are using metrozil ointments, just mixing up. The one company medicine is there, that is the pomade ointment. Okay, we are using usually. So why should we use that one? Because we are having madhugrita, which is having the healing property, so that also we may apply. Even basha, poyo, toilo, sometimes what you know, some nimbo toila we may apply. Sometimes milk also applying, that is having some little bit we have to be little bit cautious. Apply any kind of milk, the ghee, like that, because there is having some lactobacillus. Washing purpose also, or the prakshalan purpose also, we are using paya. Why we are keeping paya? You know, sometimes the patients becoming glycosemic, there also it's usually helping then and there. Even after doing Shiraveda, then and there we have to keep what you know always ready. Not only the paya, along with sometimes sugarcane juice and all, we have to be ready, because it's also giving instant energy to the patient and all. Okay, so kashaya, lepan, kalka, vyajana, shita, ushna, udaka, kataha, dini, those are things what are no, that is for tarpan purpose. Even the kashaya, okay, even for the lepan materials, everything we have to keep ready. Even the kalka, even vyanjan means usually this is the fan like things we need, because that time previously what you know, AC was not there. Okay, but nowadays it is recommended any OT, any operation theater means there the normal this bridge or normal this air flow would be restricted, because so many organisms are just flowing along with this air. So that's why what usually we are doing, we are fitting the AC, okay, to avoid any kind of microorganisms attack. But that time it was not there. So what they are doing, they are using their banjan or the fan, just whatever the air is coming directly flowing, they are just giving this opposition. Okay, so like that it is helping to get rid of any kind of infections, particular this area. So like that it has been told. And shito ushno udak, not only cold water, even hot water is required. Okay, because suddenly there is record of any clotting, that time we have to use the cold water. There is record of suddenly flow, it's became totally clot, that time we have to apply the ushna udak. So depend upon the situation, we have to keep remain ready all those things. And katahad means those bowls or utensils, by that we have to pour this hot water and cold water, whatever, even we can keep there even. Next one is also very important, that is the puri karminascha snigdhaha sthira balavantaha. So this kind of attendance is required who is very much what you know snigdha, very soft, sthira, very stable type, not continuously having some vayu prakapa, continuously jumping, laughing and running somewhere else. The surgeon is standing here, attendant is running somewhere else, not like that. He would be very much having some stable mind. Okay, they are going to obey the doctors whatever the order is given. Okay, next one is the balavanta. Why this strength is required? Because sometime previously what happened, that time anesthesia has not been recommended, because whatever the anesthesia procedures was that was not that much modernized like now. That time they are usually giving the muddupan, okay, alcohol. So after that, after having this maddu, patients are becoming little bit indigenous, okay, but they are not going to be unconscious like just like now this general anesthesia and all. So that's why whenever the incision will be given, that time they are becoming so much, they are started to scream. So for that time they have to bind properly. So why this kind of very strengthful person is required as the attendant? Because I told that is for holding purpose the patient, because they are not entirely unconscious. So that's why we have to hold them very tightly. For that, very strengthful person also required. So all those things we have to keep ready before starting operation. That is also coming under the purva karma. Okay. Not only that, whatever I have mentioned, that in which cases we have to, not only cases, even most of the cases in general we are recommending in modern science to be non per mouth or nil per mouth, whatever, NPO. But here exactly mentioned properly, that is mura garbha cases, sometimes udar roga, that previously I have already taken classes, then orcho, even ashmori, okay, even in case of bhagandar, mukha rogashu bhuktavataha karma kurvati, abhuktavata rogeshu abhuktavata karma kurvit. So this is recommended. Whatever the surgical process has been told, to know what kind of surgical process already told in our science. First of all, there is having direct surgical, that is under the pradhana karma, okay, and even some anushastra karma, that is also during this sharp instrument, the shastra. That time also little bit I have explained, okay. So usually Chedan, Vedan, Lekhan, whatever the Ashtavidya Shastra Karma told, that is Pradhana Karma. Anushastra Karma also coming under this Pradhana Karma. Anushastra Karma means Agni Karma, Shada Karma, then Raktumukshan, okay. Under that Jaluka Avacharan, Shira Veda, Prachanna, okay. Even Sringavacharana, Alabu Yantra Prayag, even there this Ghati Yantra Prayag, everything is all are coming under what you know, this Anushastra Karma, okay. And whatever the Pradhan Karma I told, for Pradhan Karma it has been told, the sloka also here mentioned, that is Ashyatu Shastrasya Shastra Karma Pradhana, it's the Karma. So Shastra Karma is the main Pradhana Karma as the as the operative measures, okay. Now this one over. Now coming to the Nirjantukaran and sterilization. Why I am going to tell this one? Because previously I told what you know, as Purva Karma, not only you have to make the patient be ready, being doctor you have to keep ready, and the instruments and the OT also. So whenever you are going through this Trividha Karma, that time sterilizations also will come simultaneously, not as a different chapter. I don't know, in your syllabus I have seen it came just like that, but both are actually simultaneously you have to read, okay. Because before performing the operations you have to make sterile, which one? To the patient, to the instruments, to the OT room. Not only that, even post-operative areas after operation, wherever you are going to shift your patient, this recovery room or sometimes post-operative room, that also should make clean and sterile. Otherwise there is the chances of the secondary infections after shifting the patient after operations and all. So that areas, not only that, even before admitting, before entering the patient, wherever they are keeping for one night staying, like pre-operative ward, okay, that is also would be clean up, like that better to say ward, female ward, male ward, hospital ward, whatever, that's also keep sterilized properly. Even not only that, the clinic, that's why I have told this is very important in this present situation. Even the clinic, those are also has been told how to keep clean. Otherwise, from clinic only the patient get infectious by any kind of disease and all, even some bacteria, virus, microorganisms. So that's why sterilization, these procedures also coming under this Purva Karma. That's your part that you have to do priorly doing the operations. In Ayurveda, it has been told as Nirjantukaran.